Hi, I'm Dr. Julie Marmon with ER Specialist Urgency Center. We like to take a few minutes every now and then to talk about some problems that we keep seeing over and over in our clinic, and one of those is sinusitis. We see a lot of sinusitis in Colorado. Part of it is because of the cold. We have lots of unique allergens here. It's that time of year when people are getting viruses, which tend to lead to sinus congestion and sinusitis. And we also just have a dry, dusty climate, which can also lead to sinusitis. So what is sinusitis exactly? We've got lots of societies that help us sort out what is sinusitis and what is just a cold and when you need to treat it. And that's the key thing. We all know that feeling of we get some nasal congestion, it's associated with a cough and a low-grade fever. That sounds like a pretty classic, what we call a cold or an upper respiratory infection. Sinusitis kicks in when you get that facial pain right through here, severe pain. Sometimes it even feels like it's deeper in your head. You can get tooth pain, particularly in those upper molars. They tend to get achy, and it might have you reaching for your face thinking you need to call your dentist. But if it's associated with sinus pain and that nasal congestion, there's probably some other things you should try first. When you have these symptoms, you'll often have what we call a purulent nasal discharge, meaning you've got just disgusting stuff dripping out of your nose or down the back of your throat. You may have fevers. You may even see some blood in that drainage. So when do we treat? What do we do? Lots of people think antibiotics are the answer immediately. I'm here to tell you it's not. There are some other things to try first. And we did in the past, we treated with antibiotics pretty rapidly. Now, when we look at what our ENT colleagues and the Infectious Disease Society of America says, they say, whoa, wait just a bit. We're treating too quickly. We should be trying some symptomatic methods of relief. This is easy stuff you can do at home. There's nothing fancy about it. And it's stuff that my family and I do every time we get a cold or start to get nasal congestion. Grab your Neilmed sinus rinse, your neti pot, or something that helps rinse through those sinuses and helps open up those sinus passages. Make sure you're using purified water or boiled water, and make sure you're using that saline packet that comes with it. Because if you don't, you will regret it because it really hurts badly. I also recommend taking something like Mucinex. Mucinex will kind of help dry up that junk that's hanging out. It'll break it up and help you get rid of that congestion that is stuck all through those nasal passages. I'm here to tell you neither one are fun. The Mucinex will dry you up. It might make you feel a little bit lightheaded and crummy. Drink lots of fluids with it and that'll help. And the Neilmed sinus rinse or neti pot, the first time you use that, you might curse me, but by about the third or fourth time, I think you'll be grateful. Those are great ways to start. You can also take Motrin or Tylenol for the pain. That'll help everything improve as well. So when do you get seen? When do you get treatment? And when do you need antibiotics? That's really the big question. We recommend, and this is again from the societies who make these recommendations that I talked about previously, if you have symptoms that at 7 to 10 days are continuing to worsen, that's a discussion for some antibiotics. Or earlier in your course, if you're developing fevers as high as 102.5 or higher, those are reasons that you should probably be seen and make sure there's nothing else going on, one, and two, have a discussion about earlier antibiotics. It seems like almost torture to make you wait that long, but we do see such terrible antibiotic resistance, and antibiotics do have side effects, and the antibiotics for sinusitis are a long course, and they're pretty what we describe as broad spectrum, meaning they can have lots of side effects, nausea, vomiting, diarrhea. They can cause infections of their own in your bowel. So we do watch out for that kind of thing. If you're aggressive with treating sinusitis at home, I know you can improve your symptoms, and the majority of the time we can get you feeling better. If you have questions, you just want somebody to take a look at you, don't hesitate. Give us a call or come by and see us.